Hello, my name's Gwyneth Hinds. I'm a retired doctor. I work now as a Pilates teacher, and I really love being able to talk to women about the menopause to help them understand what's happening to their body and what they can do to help them feel better. So what we're going to talk about today is incontinence. Lovely topic. Topic that we don't normally want to really talk about. You might be happy to talk about your hot flushes and night sweats, but we really don't want to talk about our puddles. And when you think about it, it's one thing that really can affect our sense of well-being. And it's the sort of thing that I suppose, even as a doctor, when I think about urinary incontinence, okay, yes, we do sort of talk about, oh, don't make me sneeze when my bladder's full. But really, it's something that we think that happens to old people. You know, we think about elderly ladies maybe sitting in nursing homes with their pads. It's not something we really want to think about whenever we're in our 40s and our 50s and we're trying to get on in life. And yet there are women who are really struggling with it. And actually, we now know that there are a lot more products out there. So if those products are out there, they're out there for a reason. It's because women do need them. So what is incontinence? Incontinence means that we're leaking urine, or it could be feces, or it could be farts, when we don't want to, when we're not actually sitting on the loo. If you think about, for women, we quite often maybe have little bits of problems after we've had babies, whenever the pelvic floor has been stretched, and it takes a wee bit of time to recover. And it may never be just quite as good as what it was after we've had children. But then when we get to the menopause, we may then find that there are more problems. So we also then think about, talk about different types of incontinence. And the main two things that you'll hear talked about are stress incontinence and urge incontinence. So stress incontinence is the sort of the little bit of leakage that you have if you sneeze or you cough or you jump up and down. You sort of think, well, I'm definitely not going on that trampoline. And even doing exercises, exercise classes, star jumps, and you think, oh, really? And quite often, you end up wearing your dark leggings so that it won't be as noticeable. So that's that stress incontinence. And when you think about it, what it's saying is really that it is about a balance of stress, because if you think about the stress that is pushing down on the pelvic floor, whether it's due to the fact that we've got increased abdominal pressure with our sneezing or coughing, if we're carrying extra weight, and whether or not then the pelvic floor muscles are not strong enough to actually resist that push down, and that's when the leakage occurs. Then the other thing that we talk about is urge incontinence. So that's when you're not likely to have those accidents as much, but there are times when you think, I need to go to the toilet and I need to go now. And you don't have the same ability to hold on. And also then we get into that sort of situation of, when we're about to go out the door and the last thing we do is go to the loo. And sometimes that's actually not really going to be helpful in the longer run. So you have stress incontinence, urge incontinence, and then there's going to be a whole lot of women who have a little bit of both, and it's maybe not easy just to sort of put it into those nice neat categories. Now, certainly if this is a problem, it is something you would want to talk to your doctor about. There are the gynae specialists who look at urinary control and will give you a lot of support. And there are also physiotherapists. And certainly what I've noticed in recent years is there are more and more physiotherapists, both within the NHS and also available privately, who are specialising in pelvic floor. And there's a real game changer, and it's great that there is so much more support out there for women. But at the same time, there are lots of things that we can do to start with, and maybe just to try and understand the problem a little bit more, and obviously start, and we may be able to relieve some of the symptoms with simple measures before we go to that next step. So when we think about the menopause and the problems that we have with menopause symptoms, and one of those will be the vaginal dryness. And we know that vaginal dryness, which is due to vaginal atrophy or the genital urinary syndrome of the menopause, this is now caused also affects the tissues around the base of the bladder. So being onto HRT, onto vaginal estrogen may well help those tissues there feel a little bit more comfortable, but also function a little bit better. So that may well help. It may not be the complete answer, but it's certainly one of those things that you want to just then think about to sort of get right. When we think about the pelvic floor, the pelvic floor is like a sling that sits in the base of our pelvis, which is like the bony bowl. But think about it, when we think about it as a floor, I think about that as something that's really quite static. But if we think about our diaphragm, your diaphragm is the muscle that you have between your chest and your abdomen. And as I breathe in, that diaphragm moves down. And as I breathe out, that diaphragm moves up. Think about your pelvic floor more like a diaphragm than a floor, because it actually needs to move. It isn't just about tightening. It has to be able to strengthen and to lengthen as it goes down, and then it needs to be able to react and contract, then to lift up. When we're doing everything during the day, when we're doing exercises, when we're moving, even when we're walking. So we want to have a pelvic floor that is healthy. And it's not just about making it tight, it's also about allowing it to relax, that it has to be able to function properly. So exercise is really important. You know, anybody who knows me knows that I'm usually saying that exercise is good for us no matter what it's about. And it's not that I am an exercise specialist just, but we know that exercise is so good for us in our whole bodies. It helps our mind, it helps our body, it helps our posture, but it definitely helps our pelvic floor. And a lot of things, you know, and if you go to see a physio, they will talk about specific exercises for the pelvic floor. But what I would encourage you is that if you're just active in your everyday life and you're doing exercise, especially the like of yoga and Pilates, that is going to strengthen your pelvic floor and make you feel a lot more comfortable. And it's also going to help your posture. If I do that, I'm even sitting up a wee bit straighter. But if we have that exercise and we have that good posture, and the other thing about yoga and Pilates is that we use the breath, and how we breathe, and thinking again about how we move that diaphragm, is also going to help us to just strengthen our pelvic floor and make it more effective, make it work better. So it's not just all about tightening and squeezing, it's about exercise. We want to take the pressure off that pelvic floor. So one of the things, again, that many of us will struggle with at the menopause is carrying extra weight. And sadly, at the menopause, with the change in estrogen levels, we tend to have more belly fat. We're not carrying it around our hips. So again, where's all that weight going? All that weight is bearing down in our poor wee pelvic floor. So we can do something just to help, first of all, just to stop further weight gain. That's the first thing, stop the slide. And then see, by eating well and exercising, that we can actually then lose weight. That's going to take the pressure off our pelvic floor. And again, this is something that is not just about whenever you're going through the menopause, it's about the rest of your life. But it's much better if we actually think about it now and take actions to try and help put us on the right road for the next 20 or 30 years that they can look forward to. So that's thinking about estrogen, thinking about our pelvic floor, but then also thinking about that, the bladder and whatever. And you sort of, sometimes you wonder, well, what is normal? You know, we do maybe tend to find that we're running to the toilet a bit more. So we should be aiming that we can probably stretch our toilet stops out to about anywhere between about 2.5 and 4 hours. You may find that it's different at different times of the day. And if you're having a problem, you're finding you're running a lot, even then looking at your diet and see, is there anything in your diet that is actually irritating your bladder? Because even things like coffee and alcohol may then be irritating the bladder and making you want to go more often. The other thing is that if we are worried that we're going to have a little accident, the first thing we might think of is reducing the amount we drink and restricting the amount of fluid that we drink. But think about what happens whenever you don't drink enough. If you have a look and see your urine is really dark and it's really strong, well, that's not good for our bladder, because that's actually going to irritate the bladder. So the best and the most comfortable thing for our bladder is actually to keep the contents readily dilute. So, you know, you'll find lots of people saying you need to drink, you know, 6 liters of water a day. But we're all doing different things, and it depends on your environment. It depends how active you are, how hot you are. So I think it's actually better to look at the colour of the urine, and you want the urine to be a light yellow colour, and you don't want it to be dark. So that's a good way of knowing that you're drinking enough. And then if you're drinking enough, that's going to then help to reduce any irritation of the bladder. The other thing about going just in case means that we're sending the wrong message to our bladder. In other words, we're saying, well, whenever you're half full, I'm going to empty you. So if you don't stretch it, it's then going to start to get smaller. So we actually want to stretch our bladder to get it so that it's used being at that maximum capacity, so that it knows that it can hold that maximum capacity before it has to say, we need to empty and we need to empty now. So, and you can almost talk back to your bladder. So when your bladder is sending those simple things, signals saying, I want to go now, you know that that happens when you're about to go into a meeting or you're about to go out the door and you know you've just been. And you can more or less say, it's only half an hour since I've been, I'm all right, I don't need to go. And distract yourself. Even something, you know, just clench your toes in your shoes and just unclench them. And that sensation of I need to go to the loo will probably then settle down within about 30 seconds. Now, again, this is something that you need to practice. Habits, when it takes time to change habits. So to start off with, you're probably going to do it in your house, and maybe even to do it in the bathroom before you go, just to see if you can then retrain your bladder not to want to empty when it's only half full. So if we do that, we can actually improve the strength and the capacity of our bladder to hold more urine. And those are the simple things. And certainly if you did go to see the doctor and did go to see the gynecologist, those would be the first things that they'd be asking you to try. So why not think about that first of all? It's great if we can actually do it ourselves and feel as if we're in control, and that there are things that we can do to improve our symptoms. But if in saying that you're still having problems after having tried all of those simple things, then don't be embarrassed. Go and talk to your GP, because there are the specialist gynae clinics and there are the physiotherapists out there who will support you and will help you, because you want to be able to live your life well, and you don't want something like just urinary leakage to stop you doing things in life. We want to be able to go out there and live life well and enjoy ourselves.